So to choose between an abdominoplasty and a liposuction, I will have to look at your body and make sure that you have a good skin tone so that after a liposuction, the skin will stretch back to a position that is aesthetically pleasing. If you have some loose skin, an abdominoplasty might be required to remove the extra skin and have more tension and a better aesthetic result. The length of the scar will depend on how much extra skin you have and where it goes on the sides. After liposuction, usually we have even more skin on the side and the scar has to go actually longer than what you actually can see before you have the surgery. So the length of the scar will be discussed during the consultation, and I usually draw on my patients exactly where the scar is going to be. Liposuction is almost always performed at the same time that an abdominoplasty. The liposuction is a great adjunct to an abdominoplasty, which allows us to actually shape the body and give you a better result and a more aesthetic pleasing result, especially on the flanks area on the sides. You have to wait at least 6 months after the last pregnancy before we can do an abdominoplasty. Sometimes some plastic surgeon can do it after 3 months, but we prefer to wait at least 6 months. You need to go back to your regular weight, to your healthy weight, before we can perform the abdominoplasty after pregnancy. I never use drains for abdominoplasty, and the reason I don't use drains for abdominoplasty is that I use a technique called progressive tension sutures. So basically, after we undermine all the skin from the muscle, and after we remove the extra skin and before we close, we're going to do progressive tension suture, which are sutures that are going to be done between the deep side of the dermis and the fascia and the muscle to actually close all the undermining. So there's virtually no dead space under the skin for fluid to accumulate. So that's why I don't use any drain, because there's no space for any fluid to accumulate, and then the drain is useless. Not using drain actually decreases the pain for the patient postoperatively. It allows the patient to walk faster, earlier, and of course, if you have less pain, you'll use less narcotic, which is better for you. The recovery after an abdominoplasty is 2 weeks to 6 weeks, depending on what you're going to do, what you want to go back to. For work, let's say that you work in an office and you are behind a computer, usually after 2 weeks, you're in good shape to actually start doing this. Are you going to do an 8-hour day or 12-hour shift? Probably not. But after 2 weeks, you can go back to working behind a computer. If you do a more physical activity, a physical job, that might take up to 6 weeks.